Does endoscopy diagnose hiatal hernia? Imagine trying to see inside your body without making a single cut. That's what an endoscopy does. It's a procedure where a thin, flexible tube with a camera is inserted through your mouth to look at your esophagus and stomach. Now, you might wonder if this test can tell us if you have a hiatal hernia. The answer is yes, it can. During an esophagogastroduodenoscopy, or EGD, doctors look for signs of a hiatal hernia by checking if the junction where the esophagus meets the stomach has moved above the diaphragm. Usually, if this distance is more than about 2 centimeters, it suggests a hernia. But it's important to know that endoscopy isn't perfect. Its ability to detect a hiatal hernia is moderate, with a sensitivity of around 70 to 75%. That means it might miss some cases, especially smaller hernias or certain types like paraesophageal hernias. The view can be affected by how the patient is positioned, how much air is used to inflate the stomach, and how dynamic the hernia is at the time of the test. So, while an endoscopy can show a hernia, it's not always the most reliable method on its own. Other tests can help confirm the diagnosis. For example, a barium swallow involves drinking a liquid that shows up on X-rays, outlining the shape and size of the hernia as you swallow. High-resolution manometry measures pressure at the lower end of the esophagus and can detect the separation between the lower esophageal sphincter and the diaphragm, which is a key sign of a hiatal hernia. These tests often work better together with endoscopy to give a full picture. Knowing if you have a hiatal hernia is important because it can make acid reflux and gastroesophageal reflux disease worse. When a hernia is present, the valve that normally keeps stomach acid from flowing back into the esophagus doesn't work as well. This can cause symptoms like heartburn, chest pain, and regurgitation. Identifying a hernia helps doctors decide whether medication, lifestyle changes, or even surgery might be needed. In most cases, doctors start with an endoscopy because it can also check for damage caused by acid reflux, like inflammation or esophagitis. If a hiatal hernia is suspected, they often recommend additional tests to confirm its size and impact. Combining these methods helps ensure a more accurate diagnosis and guides effective treatment. So, to answer the question directly, yes, endoscopy can diagnose a hiatal hernia, but it's often part of a broader set of tests to get the clearest picture.